Hi everyone, welcome to our live talk today. The title of our live talk today is Autism and Society. Can we evolve to accommodate it with empathy and remove cultural barriers? We're thrilled to have you here today, everyone. And I'd like to welcome Dr. Diksha. Hi, Dr. Diksha, how are you doing?
Hi, Uzma. Thank you so much for having me. Thank you for inviting me. And thank you for selecting such an amazing topic to talk
You're
about. I
welcome.
cannot wait to get started.
You're welcome. Dr. Diksha, I just want to give the audience a brief introduction about you. So you are an educational psychologist, a dedicated child and adolescent advocate, and an esteemed visitor lecturer. So I'm really happy to have you guys here today on the live, and I'm happy to have you, Dr. Diksha, sharing
Thank
your
you.
expertise in today's topic. And yeah, I agree with you. It's a wonderful topic to discuss, and I'm really excited to go into it right away. So I'm not going to waste any more time.
Sure, let's
Um,
get into it.
absolutely. So our first question, um, how can we ensure that our cultural norms embrace individuals with autism?
Right. Um, Give me a second to collect my thoughts. I
Take
think
your time.
a lot of, like, we come from diverse cultures. We work with a lot of diverse cultures, being in, the very different countries that we stay in, our origins. So I think it's about we tend to look at autism, in my perspective, and this is just my perspective, we tend to look at autism as just this thing, right? There's a there's an understanding that it looks common
Mm.
in across different cultures, or it just looks common. It's seen in boys, and this is what it looks like. You see someone throwing a tantrum in a supermarket, and then you go like, oh, is this person on the spectrum? Like, what's going on with this little boy or this little girl, right? So I think there are in lots of different cultures there is still a bit of stereotypical understanding of
Yeah,
autism, and I
yeah.
think that part of it comes from a lack of education, lack of understanding, and there is a lot of stigma attached to it. And I think we need to acknowledge that. It's true, we've made huge strides in the past couple of decades, and even now, since the advent of social media and TikTok and Instagram, and ever since COVID, it's a lot more out there. But I think the myths still exist. So it's like, in my head, I sort of think of it as two different things, right? On one hand, lots of individualistic cultures sort of tend to, it's all about survival of the fittest,
Mm,
right? It's all about being the best version of ourselves, it's about achieving our potential. All of that's great, don't get me wrong, but there's that understanding, there's the hustle culture, there's that, right? Everyone's got to be at their best, and they got to give their best and all of that. And on the other hand, you've got people with differences, with different abilities. And that's how I sort of see autism. And I think therein lies the issue. How does a neurodivergent condition play into this whole vibe of being in the hustle culture nowadays? And I think that's
interesting.
what we've got to think about. That's one thing that I was thinking about, in relation to this. And I think the only way to work around that is to first and foremost, in from any cultural background, embrace diversity.
Yeah,
And I don't mean diversity in terms of let's have an autism awareness week. That's great. Don't get me wrong. I participate in that too, but that's not enough. We need to embrace diversity and inclusion across the board, whether it's related to gender, whether it's related to different abilities, whether it's related to how you learn versus how you write versus your strengths and your needs. And that's that. And I think only when that happens will that trickle down to accepting people with autism as they are and not pushing them to be normal, to be neurotypical, or to fit into society the way we want them to.
that's interesting. That's really interesting, actually. I wouldn't have thought about the hustle culture, and
Yeah,
like the survival of the fittest that you mentioned. Um, it really didn't cross my mind, and I'm so happy that you've mentioned that because actually, when we're looking at the cultural barriers, that is something you can experience and expect. Can you just elaborate a little bit on this, because we might have our audience from all over the world, right?
Of
So just
course.
elaborate what you meant by the hustle culture, especially when you're looking
Sure.
at the cultural barriers.
Of course, of course. What I mean by, and obviously, Usma, you can contribute as well. My understanding of the hustle culture is you're constantly in this drive,
Mm,
in this mode to push yourself. This working 8 hours a day is not enough. Responding to emails in 3 or 4 hours is not enough. You got to be on it. You got a WhatsApp message. You got to respond immediately. So you've got everyone's now got. I mean, a lot of the people who are, and I don't know we are going to talk about employment. But it's like people have two phones and got two laptops and got two screens, right? So I'm trying to paint a picture here of
yeah.
the corporate world.
Mm,
I'm not stereotyping it, but this is what I see increasingly in and out. And on the other hand, you've got someone, say someone is, you might have someone who is like in their early 20s with, autism, maybe level 1 autism or what was previously known as high functioning autism, who has got the skills and abilities to do really well in the workplace, but who cannot cope with this constant, say,
yeah.
give me this and give me that and be quick and do this and do that, and that's what I feel like we need to appreciate and embrace with just like you said, with a little bit of empathy, that
Yeah.
not everyone is made to fit into this box that we
Yeah.
have created, and doesn't
Yeah.
mean that they're then not worth it. It doesn't mean that they cannot be employed or cannot have a fulfilling life or whatever that means. um, but I think there's a place for everyone, and we just need to find that place. That's what
Yeah.
I sort of wanted to say. And another thing that I wanted to say is, from a more clinical perspective, from a psychological perspective, thinking about, when you asked me about how do cultural norms affect understanding of autism, I think another thing to put out there is, how do we test for autism? How do we assess autism? Now I've gone from employment to like identification, and I've sort of gone completely, different here.
That's okay.
But it's about assessment tools, for example. They're not really sensitive to cultural differences in
Mm,
autism. I'll give you an example. So if I have a client, and I'm broadly stereotyping here, and I completely acknowledge that. If I have a client who's coming in from a culture where being by yourself is valued and solitude is valued, and being, very by the book and very technical and very concrete, see someone from Japan, for instance,
mm,
okay, and then take someone who's grown up in a very collectivist culture, right? Where you do everything together, where you lean in a lot more on others for help, and all of that. These two kids, for example, will look very different to each other when they go
yeah.
into school, right? So if you have a child from Japan and maybe say you have a child from Africa, for instance,
Mm,
they will look very different when they go into an American curriculum school. I'm just giving you a broad example, right? It doesn't mean that one of them could necessarily be on the spectrum, even though the guidelines might tell us, right, if this person is engaging, doesn't want to engage with others, or doesn't have a propensity to be really social, or this, that, or the other, you need to keep an eye out for them. So that's what I'm trying to say. The assessment tools are not really sensitive. The general public's understanding, even clinical understandings of autism, are quite varied. We've just now started to understand and appreciate the fact that what an assessment might tell you might not be the objective truth or the objective reality.
that's really interesting.
Um, so I think there's that to consider as well, and I think that falls on a lot of that falls on families, a lot of that falls on educators, a lot of that falls on clinicians. Is how, I mean, if you want, it can be easy to diagnose, right? You've got a checklist and you go tick 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 tick, and there you go. There's your label, there's your diagnosis, and off you
Yeah.
go. But there needs to be a sensitive understanding towards cultural norms and how they present in child development, adolescent development, adult development. Um, yeah, and just to be mindful about that.
That's really interesting. I never actually saw it from that angle, because you just look at it as an overall assessment for
Yes,
every child who walks in, right? Or
yes,
every adult who walks in to have an assessment done. But how could we fill that gap? Like, what would you suggest? In an ideal world, what do you see
right,
that could
right.
fix this problem or challenge?
Um, so many levels. I don't think it's on one person or just the clinicians who need to be mindful or just this or just that. I think first and foremost, I mean, we could go big to small, small to big, like whichever kind of approach. But I think there is a role to play, firstly, from a policy perspective. How supportive are we towards inclusion and diversity in general, or are we labeling it as disability? How do we support people with disability in society? And I know we want to talk about this, in a few minutes, and we will. But there's that. There's something to be done at a policy or governmental level. There's something to be done at an employability level in the corporate world. There's something to be done at the educational level, and there's something to be done at the societal level. And at the end of the day, we need more culturally sensitive assessment tools, which are not out there. I mean, look, I'll talk about myself. I come from an Indian origin, very proud about that, right? But when I see clients coming from the same origin, and when I see clients coming in who are, I don't know, maybe from the UK, they present, like I said, they present very differently, but the assessment tools stay the same. How can one set of scores be applicable to someone who comes from people who come from such diverse backgrounds? Or at the least, they need to be standardized. Or what I mean by standardized is the assessments need to be piloted, or the norms need to be generated across different countries or across different cultures. At the bare minimum, so that it slowly trickles down to clinicians and then families and then impact, the actual people with autism. So I think that's the biggest thing. And I do think generally, assessment corporations are becoming more aware of that. I do see that, but to me, it's not happening fast enough.
Yeah. That's interesting. Can you give an example, Dr. Diksha, about like you mentioned, they are doing that now, but obviously not fast enough. But what are they doing currently?
What they're doing is, I now see that, I'll give you an example. This might not be directly related to autism, but I now see cognitive assessments, or what we call IQ assessments. The people might be a lot more aware of it when I say it like that, being standardized across the Gulf, for instance, to be more sensitive to students who come from more Arab backgrounds or origins. Because think about it, right? Cognitive assessments as they stand now are standardized mostly across the US, which is great, which is useful, but I tend to use it in the context of the UAE or in Dubai, right? Coming and working with clients with different needs, working with bilingual clients. I work with so many, 9 times out of 10, I'm working with a bilingual client or client who speaks 2 or more languages. And in most of the cases, their home language or first language is not English. And I am going in with a purely English-based assessment, which is testing their verbal reasoning and how they write essays in English and how their English spellings are. And I'm like, somewhere something's got to give, right? And so that's kind of an example. That's how I see it. And
that's interesting.
Go ahead.
But if you're doing that because you're mindful about that and you understand that there's different cultural aspects going on, but what if that's not happening across the board? Then are the outcomes, the results different?
Yes. Yeah. Okay. I'm not good. I can't say a standardized, like all across the board. Yes. But I think a clinician, a psychologist, if you are in the privilege to sort of administer that, you need to put certain caveats in place. For me, I'll tell you what that looks like for me. I can't speak for everyone, right? How that looks like for me is, I will not use standardized assessments with someone who doesn't have a good grasp of English. I won't do that. I will use non-verbal assessments then, or which are heavily language reduced, which don't require me giving very complex set of instructions or questions, and which are based on a lot of non-verbal reasoning. So we do a lot of blocks together, right? We might do puzzles or blocks or work with numbers or, things like that. So I would do that. But even if I'm using a standardized cognitive IQ assessment or whatever with someone whose first language is not English, I'd always put that in my report, saying these results need to be interpreted with caution. And I wouldn't give a diagnosis or a label of, say, something like dyslexia, which is a very language-based, processing, but language-based difficulty, if I'm not 100% convinced of, of the scores. I'll be like, these are the scores. Let's try and put intervention in place and then think
Yeah.
about the diagnosis or then think about the label. And I wish that happened a lot more with autism.
Yeah, I agree. Absolutely. Such an interesting point that you've made, but we have a couple of questions here from Jacob.
Of course.
Um, okay, for me to go ahead and read them. So Jacob's asking here, we've always hear about the need to slow down, tune out of social media and take a breath. But on the other hand, there's a workplace hustle and demands. How do
Yeah.
we cope with both without feeling or without affecting one another?
Thank you for your question, Jacob. I was literally doing a corporate talk on self-care. And I use that word in quotation marks because it can be misinterpreted in so many ways. It's like the boon and the bane of my life right now. And we were having conversations about exactly this, right? And I think we've got to embrace that humans aren't really made for this hustle culture. We aren't made for that. There is a part of us that needs to ground ourselves and slow down in that. So yes, we're operating in that, yet that's not our natural inclination, right? It's become that in the past couple of years or in the past few decades or so. So I think first we need to acknowledge the dichotomy or the diversity in this and then work towards it, right? So, okay, for example, if you're spending 8, 9, 10 hours a day work in the workplace hustle and demands, as Jacob calls it, that how much time are you spending switching off, truly switching off, not answering your emails at 10 p.m. or not constantly doom scrolling
Very
for an
little.
for an
Very
hour
little.
before you sleep. And I'm guilty of that too. So I'm not saying I've mastered this.
Yeah.
Absolutely haven't, because I get pulled into this dopamine filled rush of like scrolling and
Yeah.
likes and comments and all of that like any other person. But what I'm trying to do is I'm trying to distinguish between the two.
So
Are we
interesting.
truly detoxing
Mm.
from things that are addictive, namely social media or any other addictions that we may have? Because I think look at the rise of eating disorders around the
Mm.
world. Look at the rise of mental health difficulties across the world. So all of this is connected. I'm not blaming anything. I'm just saying all of it is connected. So how much time are we actually? And it could be like little and often. So like maybe half an hour a day. Just don't look at your phone. The first thing you do, get out of bed, breathe twice. I'm not saying wait for half an hour. Guidelines are wait for half an hour, wait for an hour. We can't do that. And I get that.
Yeah.
Can you just wait for 2 beats? 1, 2, and then pick up your phone? And I think that's a lot more doable, right? Than just
Yeah.
waking up and reaching out for that. So I think little and often, because it's so easy to get sucked into this, but it's so hard to get yourself out of it. That when people go like, yeah, I'm going to detox for 10 days, and I'm like,
Is that
first of
realistic
all,
enough? Yeah.
you might end up doing it just to prove something to yourself or to someone else. It might be a challenge that you've taken up. But the moment you get back to it, your brain is going to be, well, you're going to be worse. Your behavior is going to be worse. Your brain's going to crave it so much more once you're back.
That's so
Um,
interesting.
so yeah, little and often is what I
Yeah,
would
but I
say.
mean, it's quite. I'm going to use the word scary because the 2 beats, for example, you've given that example,
Yeah,
it's literally 2 beats, but we
literally
think
2 weeks.
that's too much because we do do the first thing. What we pick up our phone.
Yes,
That's the first thing we
yes,
do.
yes.
So the
And I
two
think
beats is too much, Dr. Diksha. It's
it
too
is.
much.
I think the first thing is recognizing that
Mm,
half the people, or more than half the people, don't even recognize that this is what they do. So I think the
yeah,
first thing, any kind of behavioral change that you'd like to make, the first thing is to recognize that there needs to be behavioral change. Because
yeah,
if you're happy with it, then you do you, like, go for it,
yeah,
right? The first thing is recognizing, and the second thing is, okay, you can't do 2 beats. Can you do 1 beat?
mm,
There's a really nice book called Atomic Habits, and that's what it talks about. It's about the
yeah,
smallest possible change that you can make consistently, and then that'll become like a really big change.
yeah. The
Yeah,
1% change a day could, it's,
exactly,
360. Yeah, yeah,
exactly.
absolutely.
And
I
I think
agree.
it's about the power of being mindful more than
Yeah,
anything else.
yeah.
So yeah,
That's really interesting. To see it that way now reassures me because waking up to 2 beats is a bit too much right now. And I think
fair
doing that
enough.
1%, yeah, 1 beat is okay.
One
Then you pick
beat,
up your
that's
phone,
great.
but make
Yeah,
it a
half a
habit.
beat.
Yeah,
Exactly, exactly. If
yeah,
you can do that for say 21 days, and now people say to break a habit it takes 21 days, and then you got some research which says to break a habit you need 60 days. I mean,
mm,
whatever it is that you can do, and then sort of move on.
The
So, yeah,
little, but being consistent is
exactly.
important. I hope we've answered Jacob's question there. And he has another question, which I think goes
Sure.
back to our discussion we had earlier
Yes,
about the
let's do that.
evaluation. So,
Yeah.
how do we ensure that testing and evaluation systems are more sensitive to individuals and their differences?
Okay. I'm wondering if this question comes from a familial perspective or from a clinical perspective. I'll try and answer it both ways. And
Hmm.
just me thinking out loud. I think from a familial perspective, you've got to have trust and faith in the clinician. You've got to pick a clinician. Yes, I know cost is a huge factor, and location, availability, all of that are huge factors, especially in the UK. I really do understand and appreciate that. But I think choosing a clinician. So if you're someone who comes from a diverse cultural background, right? Choosing someone not from the same background, that really doesn't matter. Someone who's sensitive to those differences. And how can you find that out in a really practical perspective? Is I think most, if not all, clinicians have a profile, have a clinical bio on a website, on their Instagram, or wherever it is that they sort of advertise their services. And I think it's about what are you looking out for? Just get there. You'll get that synergy. You'll get the vibe, right?
Mm,
If you see someone who talks about cultural diversity and who talks about doing assessments or testing more sensitively, then that's your person.
yeah,
Whereas someone who's all about, and this can coexist with labels and diagnoses. Like, I get that it doesn't have to be either or. I think it's about looking out for that, or just asking that in during the first consultation that you have, is that my child or young person or partner, whoever it is that I'm bringing along for testing, we want someone who acknowledges this, that, and the other. And I'm sure that, with the ethical guidelines that clinicians or psychologists have to adhere to, there shouldn't be a problem. I think sometimes
yeah,
you need those reminders, and you need to play more of an active advocate role.
yeah,
That, right?
yeah,
Not giving all the power to the clinician, like, hey, you're the expert, you tell me. And I feel like we're trying to move away from that now.
yeah.
So that's why it's important to put your needs or your concerns out there.
That's a really, yeah, interesting and a very powerful point I think you've made, because we are having that shift now, aren't we? We're making that shift towards where, okay, the professionals know what they're doing.
Yes,
They're professional for a reason,
sure,
but
sure.
then we have, as parents, for example, um, we know our child better than anyone else.
Yes. So
So
how I
coming
sort of,
forward,
yeah,
yeah,
please go ahead.
no,
So
no,
I,
please, just coming forward, how would you do that?
um, so I think how how I sort of work at this with my clients, I'll just give an example, is go like, yeah, you may think I'm the expert in the situation, but I can say that I'm the expert maybe in the testing bit, or maybe in the understanding of psychological theory or educational theory, but you're the expert on your child. So let's co-create, let's do this together.
Yeah,
And I
I love
think
that.
it's about that. It's about bringing both as much as possible, because differences exist and power imbalances exist. I think it's bringing both these parties um, as much as possible, giving them the power, giving them the voice, um, and especially parents and families. I think parents, families, caretakers, whatever you want to call it, have sort of bringing this back to autism in advocating for
Mm,
themselves and for the person with autism around them, and especially if
yeah,
they're children, if they're young people, because that's what they need at that point. It's only if we can do that for them at the beginning that they will learn from us and gradually be able to do that for themselves when they're adults. I'll give you an example, right? So if you as parents, and I'm not saying you need to become, one of those parents, one of those families, like, yeah, my child needs this and my child needs that, and you're not giving this to my child, and you're wrong and I'm right. I'm not saying that. I'm saying I understand the strengths and needs of my child or my teenager. This is what I think they want, and I've spoken to them about it. Can we arrange this for them? Or this is
yeah,
not working for them. I appreciate that this intervention, this social skills group, or this therapy is great,
mm,
but it's not working for them. What else can we try? I'm not satisfied with this. So I think you've got to say that so that your child or young person can see you doing that and eventually do that for themselves. So I think
yeah,
advocacy has a really strong role um, in overcoming any cultural or
yeah,
empathetic barriers that people with autism
yeah.
face.
I agree, absolutely. And then you mentioned advocacy first from the parents, and then the self-advocacy. That's crucial as
Yes.
they're growing. It's so
Yes.
important for them to develop those skills where they can advocate for themselves. Absolutely. And this brings me to like, ensuring how can we ensure that our cultural norms embrace individuals with autism and even not just embrace, but also like how families can, like parents,
Yes.
caregivers,
Yes.
how can they overcome the cultural obstacles, I guess. I'm jumping to two questions here, but
No, no,
really
that's
I'm
fine.
interested to know.
Yes. And I think it's really good to talk about them as a whole. So I think number one, um, knowledge is power. And I don't mean Google is power. I'm gonna put a caveat out there.
Yeah.
I don't mean Google is power. I don't mean ChatGPT is power. I don't mean it like that. I mean genuine psychoeducation,
Mm,
genuine look at informed, evidence-based resources
yeah.
um, that talk about autism, that talk about
Yeah.
needs or strengths or what to look out for in your child. Because okay, I guarantee you this, okay, it's like you got a headache. You go into Google and say, I have a headache, what should I do? I guarantee you 9 times out of 10, you will get horrifying, incorrect information.
Mm,
Right? It's a similar thing with autism. You go into autism, go into Google and type, what is autism or what are signs and symptoms of autism in a 7-year-old? And you're going to get an extensive list. Now, I'm not saying that list is completely incorrect, but that list might not apply 1, 2, 3, 4 to your child exactly how it is. Or your child might be having similar difficulties, but because of a completely different reason. They could be
mm,
new to school, they could be new to the country, they might have had a difficult transition, some sort of issues or barriers at home, and number of reasons.
mm,
Right? So I think knowledge is power, and how can parents or families access these resources is, I think, by reaching out to clinicians.
yeah.
And so, I'll give you an example. Whenever we do an assessment for autism with the client, or when the diagnosis or the label sort of comes out, my first recommendation is, please look at one resource, one guideline, one author, whatever it is. This is a list that I can provide you, but you need to educate yourself. Don't
Yeah.
go onto Google or to YouTube without knowing who is the appropriate person to listen to about this, because you're
Yeah.
going to be misled in so many different directions. Or more often than not, what's going to happen is you're going to be like, but my child is not like that, so then this person made a mistake.
Good point. Yeah. Absolutely.
So I think that's that. I
Yeah.
think that's one of the things that parents and families or caregivers can do, and this then also helps to challenge those misconceptions and those stereotypes. Because when
Yeah.
you can see that autism looks different in every single, if you've seen one person with autism, you've seen one person with autism, right? It looks so different. It looks so different across boys and girls, men and women, very different presentations. And people don't know much about that, and I understand. So I think information is truly the way to get this out there. And I think you I understand why parents want to send their children to therapies and
Mm,
interventions in these clubs and that clubs, because there is still a want to fix the child or to fix their difficulties or to make life easy for them, and I get that. But I think overwhelmingly, parents of children with autism or any other additional need, anything, um, it it becomes very need focused. It becomes very negative. The narrative around the child becomes very negative, because all they're hearing at school, for example, is, you're not doing this well, you're not doing that well. Let's take you out of class. Let's give you like a learning support assistant or like a shadow teacher, whatever. Um, at home, you're shoveled to this therapy and that therapy and all of that. It's necessary, but are we focusing enough on the strengths of
yeah.
that child or young person? I think we need to shift the narrative a little bit, because if you go through school, and I've seen this because I work with a lot of young people, young adults with autism as well, and the sense that I get is, overwhelmingly throughout primary and secondary school, they said, this is wrong with you, that's wrong with you, let's get you this goal and that target and this therapy. And all of a sudden they're like, yeah, you're capable of working, why don't you go and get yourself a job? How is
Yeah.
that going to happen? How is that transition going to happen? I mean,
Yeah.
because the voice in your head's going, but I can't do this, but I'm not independent enough, but I've never been there before. So I think we need everything. We need all the supportive factors, but we also need to focus on the protective factors, the resilience of people with autism or their strengths. And we need to talk about that, and we need to embrace that a lot more than we're doing right now.
Yeah, yeah, I agree. I mean, on a personal level, on a professional level, I absolutely agree with what you're saying because we do need to look at their strengths. I'm interested, and I'm very, very curious at this point to really understand what your, I guess, point of view is on how we can do that.
Sure.
Not just a clinical point of view, but
Yeah,
even
yeah, yeah.
personal. Please, I don't mind you sharing that because I want to
Um,
understand how we can all embrace their strengths because I could see the world being so different if we do that.
yes, yes. Um, First thing, and this sort of applies to every question you've asked me and probably every question that you're going to ask me, is ask them,
Yeah,
right?
yeah,
What are you good at? What would you like to do?
yeah.
I think children, number one, any child, and secondly, neurodivergent children, or specifically children with autism, don't get asked that enough. I understand not giving them a choice with the therapeutic interventions and the support and the school and all of that. Fine. I
Yeah.
mean, I'm all about the voice of the child or young person anyway. But it's about what are you good at? What would you like to do? What brings you pleasure? What gives you pleasure? How would you like to spend your weekends? Because we're forcing them to make friends and we're forcing them to talk and we're forcing them to do this, that, and the other. Like I said, in the pursuit of being normal. I think the first thing is ask them what they think they're good at, right?
Wow.
Um,
Mm.
I don't think we do that enough. And I think, secondly, from a clinical perspective, that was like a personal thing. I mean, and you know what, Usma, sometimes I have the pleasure of working with lots of fun teenagers. You know, teenagers, very fun phase because you say what comes to your mind and you're
Yeah.
out there and you're outspoken for some of the clients, right? It's really fun. And when I asked them this question, I was like, well, but leave this, but leave your parent, but leave your teacher, what they say. What are you good at? What do you want to do?
Yeah.
And they just go like, no one's ever asked me this question before. I
Yeah.
don't know how to think about it. How, when they're like 18, how can they select a college? When they're 21, how can they determine all of those big things if they've never been given those choices or that option when they're younger?
That's a concern, actually.
That is
That yeah. Yeah.
um lost track of what I was trying to say after this. But yeah, I think the first thing is ask them. And I think the second thing is, look, from an educational perspective, if a child or young person with autism has an individual education plan or a behavior support plan or any of the plans, right? I think they need to have more of a focus on strengths. They need to talk
Yeah.
about strengths in meetings or in the UKF annual reviews and all of that. You need to talk about strengths first and foremost, it will seem like a chore. It will seem like a tick box. And I get that. I've been there, right? Oh, this is a part of the form that we're required to complete. Sure. But then it's thinking about um, how can you incorporate those strengths into their daily life?
Yeah.
So if your kid with autism says, I like badminton, I like video games, I don't know. I had a client who was really cool. He was like, I want all the encyclopedias in the world. And I was like, sure, within
Yeah.
reason, of course, but that's where their strengths were, and they wanted to work on that. I think we're focusing too much on the weaknesses. I'm going to keep saying this, but ask them what it is. There need to be more conversations around it. And then can you build on the strengths? Because we build on the weaknesses. We try to get them to be better listeners or better communicators or better behaved children or whatever. How are we building on their strengths? Because eventually, okay, that's what's going to get them the job. That's what's
Mm.
going to help them succeed. I mean, no one aims for a job where, I mean, uh, to do something that they're horrible at. Everyone wants to do something that they're good at,
Yeah.
or they have a propensity towards, or or they like, or whatever that is. So I think these conversations need to go back to the early stages.
I agree. And honestly, there's so many questions that come to my mind now because and the different layers, honestly, the different
Yes,
layers because
yes,
one of them is like you said, educating. So
Yes.
educating the families, educating the schools who are spending time with the children. And
Yep.
I see more of a coaching aspect here. So
Yeah,
asking those
of course.
coaching questions,
Of
allowing the
course.
space for the children to think and to answer. And then once
Even
you've
if
got
they
the
don't know
answer,
the answer right now,
yeah,
you can
yeah,
be like, yeah, you can think about it and let me know, or
yeah,
give them options, but at least give them some choice, some
yeah,
ownership, because that's where the advocacy and all of that is going to come from. It's
yeah.
not, it doesn't magically appear after the 18.
It doesn't magically
Like,
appear with
you
the
go out
18.
there,
Yeah,
like you go out and make your own life, and you go out there and get a job, or you go and go to college. Like, it doesn't magically come. It doesn't
it
magically
doesn't.
appear at midnight, when the clock
When they
strikes
turn
12.
18, I agree. Absolutely. It's going to be something that's going to take time and you're going to build on it. I
Yes.
can see that. But how do we do that? How do we educate our parents and on our educators even that are working? Because I honestly agree 110% that we have to look
Yeah.
at the skills that they're good at and
Yeah.
hone into those. And once you
Yeah.
hone into those skills, it could be
Yeah.
tech based. I'm going to give that example.
Of course.
So, for example, you have a child who's really good at tech,
Yeah.
and then you're trying to teach them other skills during their childhood.
Sure.
Rather than doing that, you spend time giving them the opportunities and the
Mm.
resources to hone into that skill,
Yeah.
and then you know where they're heading into when it comes to work.
Yes.
So what do we want at the end of the day? We want them to be independent, financially independent.
Sure.
We want them to be confident.
Yeah.
We want them to have an understanding that they can do that achievement kind of mindset that they can do it rather than the inner critic. It's the inner coach
Yes.
mindset that they have.
Yes.
So
Yes.
we have to start early. We have to
Yes.
start from the get go, from
Yes.
home to
Yes.
school, and then progress. Then they can be confident when they enter the workplace.
Hmm.
Without
Hmm.
this, work that's being done in the early years, they're not going to become confident when they enter the workplace.
Nope. Nope. And trust me, if I see someone, okay, if I see a child who's 7 years old, for instance, with autism, who hasn't had that acceptance, that early support, the the appreciation for who they are, despite
Mm,
having
mm,
autism, whatever. And I see someone who's had that. You can see that so easily. They become independent a lot more quickly. They know how to ask for help. And I don't mean independent as in, hey, I don't need no one in my life.
yeah, yeah,
But
yeah,
hey, I know when to ask for help. I know
yeah,
whom to ask for help. And that translates so easily into a successful life, whatever that may look like for them. And I think, like you said, I think you brought up a very valid point here, and that is these things need to be embraced from the early years. And I'm not
yeah,
saying we need to go into classrooms and talk to kids who are 5 years old about autism. We just need to talk to them about how people are different, how every kid is different to the other, and we appreciate and love each other as we are. And you
mm,
can do that so easily. There are lots of books out there. There are lots of games out there. And I know lots of schools are trying their best to sort of do that. But I think they do it very well in terms of people coming from different cultures. Let's have an international day. Let's have a culture day. Let's have all of that. But let's also have a people don't talk, and that's okay kind of day. Let's have a
yeah,
people who like to not make friends is okay kind of day, right? I don't know
yeah.
what that would look like.
Or people who talk
Um,
about the same topic, because they do.
there you go.
A lot of them that are interested in the same topic.
Yes,
We, I mean, again, I'm going to look at it from a parental kind of point of view here. As parents, we get so tired when our child is talking about the same topic, but little do we know that this could be something really big for them in the future.
yes,
So
yes.
embracing that is so important. Okay,
One.
creating boundaries is important as well, but embracing
Absolutely,
it
absolutely.
equally.
Yeah, 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 of course.
Yeah.
I mean, every single party that you go to, you cannot talk about your special interest or, like, whatever.
Mm,
If you like robots or toys or cars or, Thomas the Train Engine, whatever.
mm,
I mean, sure,
mm.
sure, sure. But there's a time and place for that. But I think what is slowly happening nowadays, and what I think a little bit more should be out there, is okay, we think about education as the curriculum, the American
Mm.
curriculum, the IB or national curriculum, or whatever that is, right? And we've got to follow the curriculum to the T. Fair enough. How about taking that interest or that strength of that child or young person with autism and teaching them math according to that, teaching them
Yeah,
English according to that, or whatever it is that they're struggling with at school, keeping that thing in mind? I guarantee you're going to have a much easier route
absolutely.
if
So
you
that
take their strengths
absolutely,
into
and it's such an
consideration.
important point you've made here. And I'm sorry, I think I'm getting really excited. But the thing is, it's schools that need to change. Then the system needs to
Yes,
change.
Yes, 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 yes. Of course. Like I said, like you said, there has to be a layered approach to this. So I
Yeah.
think, in general, as awareness, as conversations like these take place, I mean, I've been to a couple of conferences that I've been really inspired by, where these conversations are happening, or where they're multidisciplinary conversations, like,
Mm-hmm.
us talking to pediatricians about it, and then, talking to educators about it, or, like, people
Yeah.
who are involved in the child or young person's life.
Yeah.
The more we talk about it, the more, you can't really blame people for being in the wrong, for society to be in the wrong, when they don't have the understanding, when you haven't shown them the mirror.
Yeah.
You got to do that and then expect them to make better informed, better educated choices.
Yeah.
So I think that's why psychoeducation slash awareness slash information, dissemination is really important in the right way, because then you can hold people accountable. Be like, yeah, you're not doing this. You're not very helpful as a society. That blame game, that exists. And I know parents and families are so annoyed, and they're so bothered, and they're so like, we can't take our child out anywhere, and we're so embarrassed. And I get that. Like, they've got to change their perception, but equally society's got to change their perception as well for them to be able to comfortably do that.
Yeah. We need to make that shift.
Yes.
We definitely need to make that shift because, honestly, I don't believe in the division in our society. So what we have created is a divide, and we need to
Yes.
remove that. The minute we
Yes.
remove, and like you said, it's going to take time.
Yes.
It's going to be conversations like this that take place, conversations
Yep.
in, conferences,
Yep.
whatever, talking to your friend, talking to your neighbor. It's so important because the more we talk about it, the more we're going to accept
Sure.
everyone's differences and embrace them. That's
Mm-hmm.
really important.
Mm-hmm.
Not just create this division in our society. Absolutely
Yeah.
agree. I agree. And I can't believe it's been 40 minutes already.
Oh, wow. Okay. Fair enough.
Yeah, 40 minutes already. So we have to wrap up,
Yes.
unfortunately.
Yes.
I had many more questions that came to my mind that I wanted to ask you, and it's such an interesting discussion that we've had today. And I do think we will have to carry on further if you're okay
Yeah.
with your time.
Of
Next time we
course.
can arrange, another a discussion based on this because there's so much to talk about.
Yes.
So
Yeah.
much to talk about in this, absolutely. And I appreciate your time today, Dr. Diksha.
No
Really, it's
problem.
been wonderful learning so much from you. And from a professional point of view, a clinical point of view, I've learned a lot. Honestly, I've
Thank
learned a
you.
lot
And I
today.
and I
So
genuinely hope that this sort of conversation. I mean, I don't mean for it to be educational in a sense, but if I think it's even helped one person to open their minds to a
yeah,
different perspective,
yeah,
whether they agree with it or not. I'm not talking about the objective truth here. I think my job here is done. So
yeah,
thank you for having me. Thank you for the
absolutely.
platform. Thank you for all the questions.
No, you're welcome.
Yeah.
Thank you so much. Thank you. And you have a good day, Dr. Diksha.